Hello everyone. Today we'll be talking about the development and growth of teeth. It is one of the very important chapters and it will be asked as an 10 marker for sure in your first internal because it will be the first chapter to be covered in your BDS first year, and even in your university exams it will be asked as a 10 marker or a 5 marker or any small question of it as a 2 marker as well. So I'll cover the whole topic, then I'll tell you what all questions can be framed and how you have to write. So before beginning the development of tooth, we'll see actually what happens in the fetus, in the womb of a mother when the child is developing. The teeth will not just start forming, right? It will have a process. It is a complex process. It will start in the embryo itself. So what happens in the embryo, that we'll see first. So imagine this is an embryo. So this is the developing brain of the child. This is the heart and this is the foregut that are developing in an embryo. And this depression over here that you see here, right? That is the stomodium. Now what is stomodium? Stomodium is the primitive oral cavity. The oral cavity that we have today, the mouth and all the features that we have, the cheek, the mouth, everything, that in a primitive stage in an embryo is known as stomodium. So what happens at 6th week of intrauterine life, this stomodium will show an epithelial band. What that epithelium band is known as? It is known as primary epithelial band, right? And this epithelial band will divide into two structures. Let us see how it happens. So think this whole thing is the stomodium, right? And this here is the developing cheek. This is the cheek that is developing, and this is the developing tongue, this extension. This thing that you see here, this whole thing, this is the primary epithelial band that I was talking about. So this primary epithelial band at about 7 weeks, it will divide, right? It will divide into two things. That is, one is the vestibular lamina, and another is the dental lamina, right? Dental lamina, from which the tooth forms. So let's start with the dental lamina. This dental lamina, it will go on proliferating everywhere, but in some places it will proliferate more. The cells are going on proliferating everywhere, but in some places like this, it will proliferate more. The places where it proliferates more, these things are known as dental placodes. Okay, these things are the dental placodes. These areas represent the future teeth. This is where the future teeth will be formed. This is the starting point of the teeth to form, right? So let's start the actual development of tooth now. So the tooth development is divided into 3 stages: the bud stage, the cap stage, and the bell stage. So this dental lamina, the extension of the dental lamina which came down, as I was telling, those things are known as the dental placodes, and the extension of that is known as the enamel organ. So this enamel organ, as it goes on growing, it will assume different shapes. So based on that, the stages are named. First, it takes up a bud, shape of a bud. So it is known as a bud stage. Then it assumes a shape of a cap. Then bell. So that's how morphologically the stages are divided based on the shape that the enamel organ assumes. So first we'll talk about the bud stage now. Let's start with the bud stage. This is the first stage of tooth development. And here, as I told, see, here enamel organ looks like a bud. That's why the name is bud stage. Here what all is present? This over here is the oral ectoderm. This over here is the oral ectoderm. This is the enamel organ, and this thing has two sets of cells here, as you can see. These cells, the outer cells, they are cuboidal in shape, and these cells, first they'll be cuboidal, then they'll become low columnar shaped. The outer cells are low columnar shaped, and the inner cells are polygonal in shape. What shape? Polygonal. So, two sets of cells are present. What are they? The peripherally placed low columnar cells, the centrally placed polygonal cells, right? And this condensation over that you can see here, you're seeing, no, the cells are condensing here like this. What is that? That is the ectomesenchyme. That is the condensation of ectomesenchyme. And this condensation of ectomesenchyme, the structure is known as dental papilla. Okay? Dental papilla. So, what happens here? This enamel organ, it is called enamel organ, no? Why is it called so? Because it gives rise to enamel, the structure. Enamel being, you know, the outermost covering of the tooth. So, the enamel organ gives rise to enamel. And this dental papilla that I was talking about, this dental papilla, it gives rise to two things, that is dentin and pulp. Understood? Dental papilla gives dentin and pulp. Enamel organ forms enamel. So that is all about the bud stage. What all you will write in bud stage? You'll draw the diagram first, then you'll write about the two sets of cells, and then about the dental papilla you'll write and what all it forms. There's one more structure called dental sac, which is not evident in the bud stage. In the next stage, we'll see that. Okay, that was about the bud stage. So coming to the cap stage, you can see the difference here. The enamel organ, it is growing down. This is the oral ectoderm. And this is the, right, these cells is going on growing down. The enamel organ is going on growing downwards because the fetus is growing. This is going on growing downwards. But this growth is not like it was small, but no, it is not just growing down like one big ground, right? It is growing unevenly, right? It is growing unevenly. That is because the cells here are not proliferating. The cells only in this area and this area are proliferating. So it assumes a cap shape, right? That's why it is known as cap stage. And the cells which cover the convexity of this cap are known as outer enamel epithelial cells, right? And then the cells which cover the concavity of this enamel organ, the cap shape, those are known as inner enamel epithelial cells, right? So this outer enamel epithelial cells, they are cuboidal in shape. Okay, and the inner enamel epithelium, these cells, as you can see, are columnar in shape. Cuboidal meaning the length and the breadth of the cells is same, right? Tall columnar meaning the length is more, right? The length is more than the breadth of the cell. So the outer enamel epithelium will be cuboidal in shape. The inner enamel epithelium will be tall columnar in shape. And then the central cells, those which was polygonal in shape, what happens? It will assume a star shape, right? Why it happens? From the ectomesenchyme, the water is going on being drawn into the these cells, the polygonal cells. So it will go on extending. The water is going down into it inside. So what happens? The cells will go on swelling, and the cells will try to separate from each other because the water is going on inside them, no? So they'll go on separating to accommodate the water inside them. But what is happening? The cells are not losing contact. They are not like haphazardly moving away. There is some cytoplasmic extensions between them. They are maintaining their extensions, cytoplasmic extensions. That's why these cells are known as stellate reticulum. What are they known as? They are known as stellate reticulum cells because they are star shaped. That's why stellate, and reticulum because they are maintaining the contact with each other with these cytoplasmic extensions. So stellate reticulum cells. So what are the important cells here in CAFT stage? One is the outer enamel epithelium. This is outer enamel epithelium. This is the inner enamel epithelium. And this is the stellate reticulum. Okay, to talk about stellate reticulum, what is the function of it? Because it has all water inside them and it acts as a cushion. Because of the water inside it, it will act as a cushion, and because of that, it has a shock absorber function. It acts as a shock absorber because it is very delicate. The whole enamel organ is very delicate, no? So this stellate reticulum will act as shock absorber, right? And then the dental papilla I was talking about, right? The below, right below the here is the dental papilla, which formed dentin and pulp. And this thing over here, which the ectomesenchyme, which covers the outer enamel epithelium, no, all this part, this is the dental sac. And dental sac has another name as well. What is it? Dental follicle. Dental follicle or dental sac. And this dental follicle, it forms the cementum, it forms the periodontal ligament, and even alveolar bone as well. All the periodontium structures, right? Those are formed by dental sac. So what all are important in the CAP stage? The outer enamel epithelium cells, the inner enamel epithelium cells, the stellate reticulum cells, and then the dental papilla and the dental sac or the dental follicle. And all the shapes and what all they do, you have to write that. Okay? And then next, coming to the early Bell stage. So this Bell stage, no, it is divided into two types. Now the cells are going on proliferating. The cells don't stop. They are going on proliferating. So what is happening? This enamel organ assumes a bell shape, right? It looks like a bell. So it is known as Bell stage. So what is happening here? The stellate reticulum is also going on increasing because of intake of water inside. It is going on increasing. And one important thing that occurs here, the transition between the CAP and the early Bell stage, is that I'll show you. Here the dental lamina is there, no? But as you go on to the Bell stage, this extension is lost. The dental papilla that is present here, that is lost. So it will be completely detached from the dental lamina. So while detaching, it will leave out some remnants. It will not go completely, no. It cannot completely erase off. It will leave some remnants behind. These remnants are known as remnants of dental lamina. Other name is cell rests of serrae. What are they called? Cell rests of serrae. So that these cell rests of serrae in future, in some people, they are present in everyone, but in some people, after when they are born, after they become adult, or even in childhood, they go on proliferate and form some pathologies, some cyst, some tumor or anything. That all you learn in third year. But it is important that you write, if you write this, no, this will all give you brownie points. If you write about the dental rests of the dental lamina, right? That was about the dental lamina, which is lost in the early Bell stage, and then two new cells are coming here. You can see, the morphology is different here. There are increased number of cells. This was the inner enamel epithelium and this was the outer enamel epithelium, right? And what is happening? They are going on condensing here. And here you can see the inner enamel epithelium cells. They are proliferating. They became tall columnar. They were tall columnar before also, but the nucleus was this side. But now the nucleus has gone to the opposite side. If you can observe here, here it is enlarged. See, you can see here, no? It is enlarged. The nucleus has gone to the opposite side. So these inner enamel epithelium cells, they have divided into amyloblasts. What have they divided into? Amyloblasts. Only, not all of the cells, only some of the cells. And what do these amyloblasts do? They'll produce enamel. Okay, and when this amyloblasts are formed, what will happen? The inner enamel epithelium cells, they'll signal the dental papilla. This is the dental papilla, no? They'll signal the dental papilla to form the odontoblast. The cells you can see here, no? This was not there before. This odontoblast, this layer, these cells. These are the odontoblasts. You can see here, no? This thing, these cells. These are the, what are they? They are odontoblasts. And what do odontoblasts do? They'll form dentin. Enamel, dentin, these are all the important structures, no, in the tooth. So amyloblasts here will form enamel and odontoblast will form dentin. And this is the outer enamel epithelium, which is normal. It has not changed. Little it is becoming low cuboidal. It was cuboidal, no? It is becoming low cuboidal because it has to condense a lot, so it has changed its shape. It is becoming low cuboidal in shape. Okay, and then one more thing, what is happening? You can see the cell layers have increased. Now, before there was just outer enamel epithelium, inner enamel epithelium. So this thing you can see here, this cells, squamous cells. You can see here, no, they're flattened cells with nucleus in the center. So what are they? They are stratum intermedium cells. Stratum intermedium cells. Outer to the inner enamel epithelium they are formed, no? So they are known as stratum intermedium cells, which are very important for the enamel to form. Okay, that was about the early Bell stage. So what are the different cells here? There is inner enamel epithelium still. There is also outer enamel epithelium. Stellate reticulum is also still there. And then what are the new cells that are added here? Amyloblasts are forming, and because of induction from that, odontoblasts are also forming. And what else is there? Stratum intermedium cells, right? These are the additions in the early Bell stage. Okay, that was about the early Bell stage. So what happens next? We'll talk about advanced Bell stage. So Bell stage, as I was telling, it is divided into early and advanced Bell stage. Advanced or other name is late Bell stage. So what are you seeing here? The stellate reticulum is it was going on increasing, no? Now it is collapsing because of the formation. These structures that you see here, the red and black structures, these are the dentin and the enamel that are forming. So because of that, the stellate reticulum is going on collapsing, right? So what all happens in advanced Bell stage, I'll tell you first. First, this thing that you see here, no, the outer enamel epithelium and the odontoblast, this thing is it determines the future dentino-enamel junction, right? What all happens in advanced Bell stage? The apposition starts. What is apposition? The formation of the hard structures, that is the enamel and the dentin. That is what starts here. And also the root formation. Here the root formation also begins. The root formation downward it begins. That we'll cover in the next class. But what all happens actually? The hard structures are formed and the root formation also begins in the advanced Bell stage. Okay, so let's see how it happens now. What happens first? First, in early Bell stage, what had happened? The amyloblasts, these are the amyloblasts were formed, and then odontoblasts were formed. Here what is happening? The stellate reticulum is going on collapsing, right? And then what is happening? The dental papilla will signal the odontoblast to form dentin. This red color thing is the dentin. First dentin is laid down. First layer of dentin. This red thing that you see is the first layer of dentin, which is known as mantle dentin. First layer of dentin is laid down, and then this dentin, when it lays down, no, it will signal the amyloblast. These are the amyloblasts, no? Tall columnar cells with nucleus placed away from the basement membrane. These are the amyloblast. This dentin formed, it will signal the amyloblast to form enamel. So that's when enamel also forms. Right? Enamel, the black thing that you see here, that is the enamel being formed. So first the dentin forms and then the enamel formation also starts. So the dentin formation will move pulpally and this is the developing pulp. This dental papilla, this is the developing pulp. So the dentin formation moves pulpally towards the root surface, whereas the enamel will go on depositing on the first layer of dentin upwards, that is cuspally, towards the cusp, right? So what all happens in the advanced spell stage? The mineralization starts, right? And the stellate reticulum collapses, and then future DEJ, dentino-enamel junction, this thing is determined, right? This is all what happens in the advanced Bell stage. So, what all we studied today? We studied the first, what we studied in the embryo, what happens. We studied, no? That is the part, embryology part. Then what we studied? We studied the 3 different stages, right? That is the bud stage, cap stage and Bell stage, right? So, when a 10-mark question is asked for you, describe the development of teeth. What all you will write? First, a little bit about embryology you can write. You can just draw the diagram that I drew. Not necessarily you need to draw a very good diagram, just a rough diagram for the examiner, for the people who are correcting, no, they should understand that you have understood the subject. If you write the embryology and then move on with the bud stage, cap stage and Bell stage, they'll understand. If you just, they'll ask what will be the question? Developmental stages of tooth formation. You'll just write the stages, the 3 stages. If you write it, they'll think you have just mucked up, you have not understood the topic. If you write little bit of embryology and then if you start with this, then they'll know that you know the subject, you have understood, and then these with all these things, no, if you write embryology and all, they'll get extra brownie points. So, and as a 5 marker, they can just ask the Bell stage, cap stage, or the bud stage. Anything they can ask as a 5 marker as well. And even they can ask dental lamina as a 2-mark question. At that time, what you write? How it is formed, and when the remnants that they'll move. I told, no, cell rests of serrae, what all they cause, all that you can write as a 2-marker. All these questions will be asked as a 10-marker, as I told. 2-marker also, dental lamina, or even just draw the Bell stage or something like that they can ask. You have to just draw it. You know how to draw, you have seen the diagrams. So diagrams are very important and you have to correctly label it, and then you can get very nice marks for your correct presentation, right? So that was about the development of tooth. Thank you.